Hello, my name is Oluwaseun Anyam, Sean for short, and I am the Royal College of Physicians London Trainees Committee representative for the North West London Deanery.
And my name is Caitlin Morgan and I'm the representative for the Severn Deanery.
We have developed a number of videos to provide you with information about the new internal medicine Stage 1 curriculum, which came into effect in August 2019. These videos are for trainees as well as supervisors to disseminate important information about the new curriculum and to help ease the transition into it.
This first video will provide you with a quick overview of the new curriculum, particularly focusing on the key changes from previous core medical training curriculums. Subsequent videos will explain the new curriculum in much more detail, and we hope that by the end of this series you'll be clear of what's expected of you as a trainee or a supervisor and how to get the best out of it.
We thought it would be best to start by showing you the aim of internal medicine Stage 1 training, which you can see displayed on your screen. This is lifted directly from the curriculum document and highlights arguably the most important change from the previous curriculum.
The focus of internal medicine training, or IMT, is essentially to facilitate your progression from a post-foundation training doctor into a competent medical registrar. This puts a firm emphasis on the training programme to ensure that by the end of the 2 or 3 years you are able to fulfil the role of a medical registrar confidently, and there are a number of aspects woven into the curriculum to enable this.
This aim also recognises the need for doctors who can manage patients with multiple comorbidities in an ageing population within the UK National Health Service. This has been informed by multiple reports and studies into how to create a highly trained, highly skilled medical workforce that is capable of delivering effective and compassionate care in the 21st century.
So the question is, how will this be achieved? Over the course of the training programme, you will be required to demonstrate satisfactory development in 14 broad areas called Capabilities in Practice, or CiPs. We will return to these later in this video, and they will also be covered in detail in other videos.
In order to demonstrate your development in these 14 CiPs, you will need to collect evidence during your clinical attachments. This evidence will range from assessments of your observed practice to your own personal reflections and will need to be recorded on your e-portfolio.
At the end of each training year, your educational supervisor has the responsibility of reviewing all the evidence in your e-portfolio. They will make a judgment of your competence in each of the 14 CiPs and will document this in their report.
After this, at your annual review of competence progression, or ARCP, meeting, the panel will review these judgments and make a final decision about whether you can progress into the next training year or ultimately into Stage 2 training. More information about each of these stages will be described in detail in subsequent videos.
There are a number of items you will need to collect during your clinical attachments to use as evidence of your training and demonstrate progression in each of your 14 CiPs.
These include supervised learning event or workplace-based assessments, supervisor reports, multi-source feedback, a logbook of outpatient clinic attendance and participation in the acute take, a quality improvement project assessment, and certificates showing teaching attendance and MRCP examination completion.
Again, there are subsequent videos which are dedicated to describing these in detail, so by the end of this series you will be fully aware of what these are and how they can be used to evidence your training.
Time to look at the capabilities in practice in some more detail. So, as we mentioned before, there are 14 CiPs, which are subdivided into 2 types, generic and clinical.
Generic CiPs describe behaviours that are expected of all doctors trained within the UK NHS, and these CiPs are common across all specialty curricula, from paediatrics to surgery.
On the other hand, clinical CiPs are competencies that are specific to internal medicine training. These stretch from IMT Stage 1 right through to the end of Stage 2, i.e. registrar training, so that by the time you complete your specialty training and are eligible to become a consultant, you will be deemed fully competent in each of these CiPs.
Take some time to read through each of these as they will form the basis of your training in internal medicine. They can also be found in the curriculum document and in the ARCP decision aid and will be talked about again in subsequent videos. The development of these capabilities in practice represents one of the most significant changes from the previous core medical curriculum. Training is now based on demonstrating progression in 14 broad areas directly related to the professional skills required to perform the role of an internal medicine specialist doctor.
The focus on 14 CiPs, rather than approximately 120 competencies, as was the case in the previous curriculum, means there is much less box ticking, something that was repeatedly highlighted as a problem with that curriculum.
In addition, IMT is now a 3-year training programme, which is a change from the previous 2-year programme. This gives you more time to develop into a competent registrar, allows exposure to a wider range of specialities, and means that you will have an extra year to complete your MRCP examinations.
It is important to note that for some specific specialties, there is the opportunity to apply directly to them after the 2nd year of IMT. We will come on to this later. IMT also has a greater emphasis on preparing trainees to lead the acute medical take, a key role of the internal medicine registrar.
As well as this, experience of outpatients and ambulatory care is also emphasised more, again, important roles of the internal medicine registrar.
Training in the care of elderly patients with multiple comorbidities is another key area of emphasis, in line with the aim to train doctors capable of managing our ageing population.
Importantly, the role of the educational supervisor is much more significant, as they are now tasked with the responsibility to review your evidence and decide on your level of competence prior to your ARCP. Consultant colleague reports also carry more weight, as these will feed into your educational supervisor's assessment.
Finally, it is now mandatory for each trainee to rotate through a placement in elderly and critical care. Particularly in the case of critical care, all trainees will have the opportunity to gain competence in procedural skills that are not commonplace on medical wards.
It is also important to highlight that certain things like assessments, supervisor meetings and e-portfolio remain important aspects of the new curriculum.
To demonstrate the differences in the training structure, this diagram shows a previous core medical training programme. After 2 years of foundation training, trainees then face competitive entry into a 2-year core medical training programme. After this, they face competitive entry again into specialty registrar training, which lasts for 4 to 6 years.
In the new IMT programme, the majority of trainees will go through 3 years of training after their foundation programme. They will then face competitive entry into Stage 2 training. This is expected to last for 4 years and will still contain elements of internal medicine training within it.
This is the pathway for Group 1 specialties, in which trainees will obtain dual accreditation for both internal medicine and their specialty. It is expected that most trainees will progress through this route.
However, there are certain specialties which will not require trainees to achieve dual accreditation with internal medicine. In these cases, trainees will be eligible to apply to start training after the 2nd year of IMT, and again, this is expected to last 4 years in length. Importantly, trainees can choose to apply to these specialties even if they've completed the 3rd year of IMT.
Here is a list of the Group 1 and Group 2 medical specialties. It is important to be aware of them, particularly if you are interested in applying to one of the Group 2 specialties.
More information about this and the different routes of progression to Stage 2 training can be found on the JRCPTB website.
Thanks for watching this video. For further information, visit the JRCPTB website, where you can find the full curriculum document, the rough guide to internal medicine training, a guide to using the e-portfolio, and a section of frequently asked questions.
If you have any other queries, you can contact us using this email or via the JRCPTB Twitter account.